traditional epilepsy studies are placebo-controlled double-blind studies, and they do an observation phase, and subjects in the observation phase for a while, for a couple months, few months, and see how many seizures they're having per month. And then they go into double-blind phase, and again, it's also a few months, and we see how many seizures they have over that period of time, and basically are comparing them. The problem is there was a study that was out just a few years ago that showed that subjects who are in anti-seizure medication trials, and this was over 100 trials they looked at, subjects who continued to have, who were in placebo or in treatment that wasn't working, had a much higher, I think it was about 6 times higher rate of SUDEP, sudden unexpected death in epilepsy, in those trials. And we know that the type of seizure most associated with it, the higher risk, is the generalized tonic-clonic seizures. So to have someone in a study like that with a typical observation period and then a typical double-blind period, makes them they're at a much higher risk over that period of time if they're on placebo or treatment that's not working. So, the design of this trial is kind of a new idea in which that the observation period was really retrospective, and so we're not observing them prospectively, and they're not having more seizures. It's just a retrospective observation phase, and then the double-blind phase is actually the time to event. And so, after their second seizure, after a month, then they are able to go straight into open label. So, as opposed to having to stay in the double-blind period for 12 weeks or however many weeks it is, if they're still having seizures after a month, they go straight to open label. So less seizures during observation phase, less seizures during the double-blind phase, and then we basically compare the subjects who end up being on placebo versus subjects who end up on treatment, and see who had a longer time period between when they started treatment and their second seizure. And so we feel like this is a much safer study. It really decreases the risk of SUDEP, and I really think it's something, probably studies like this are probably going to be, this is the way I think they're going to be run in the future too, just because of the safety aspects.